Okay, good morning everyone. I can report 15 new cases overnight, 7 linked and 8 under early investigation. 2 only were in quarantine during their entire infectious period. We are aware that at least 7 have spent part of their infectious period in the community, and our contact tracers are chasing down the details in relation to the others. 8 people are currently hospitalised and 1 person remains in ICU, still requiring ventilation. A solid day of testing yesterday, 3,639 tests. On the compliance front, there were 2,735 traffic stops as part of the joint ACT New South Wales police operation, and 43 directions to leave the ACT were issued. Yesterday afternoon, National Cabinet met for around 2.5 hours. During the meeting, on the topic of vaccination supply, I raised concerns with the Prime Minister about the projected vaccination supply for the ACT. Under the proposed Pfizer supply to be allocated to the Territory for October, it appeared that the Commonwealth had reduced the Territory's allocation. The Prime Minister has noted these concerns and conversations are now underway directly with the Commonwealth Health Minister's office. We've had some initial assurances that there was no intention to reduce the vaccine supply for October, and we hope to get further clarification on the week-by-week supply schedule of Pfizer for October over the course of this weekend. Yesterday we reached 77.4% of our 12+ eligible population with at least their first vaccine dose, and 53.1% of the 12+ population have now received both doses and are considered fully vaccinated. Another very encouraging sign, we can now report that over 90% of Canberrans aged 40+ have received a first dose of a vaccine. So this is another very strong indication that 90% vaccination across the entire population in the ACT is achievable, and with the forward bookings we have in our system, it's a target that I think we will surpass. Our priority over the next 4 weeks is to vaccinate as many people as possible, as quickly as possible. AstraZeneca is available today through GPs and pharmacies. Pfizer is available through GPs and the ACT Government's mass vaccination clinics, plural. I'd advise people to continue to check online regularly as earlier appointments frequently pop up. So jump onto the My Digital Health Record system or go through the GP network and you may well find a significantly earlier Pfizer appointment will become available. We've been advised by the Commonwealth that Moderna will be available through pharmacies next week, which is great news to further accelerate our vaccination program. A highly vaccinated Canberra is a much safer Canberra. National Cabinet considered updated modelling from the Doherty Institute yesterday. Concerns had been raised at previous National Cabinet meetings about the scenarios presented in the August Doherty Modelling Technical Report. In response to these concerns, further work was undertaken, and the Institute has now advised the following, and I quote, "Given the observed sensitivity to high seeding infections at 70%, ongoing application of medium public health social measures at the time of transition to Phase B, and this is the 70 to 80% point, is deemed prudent in such cases, at least until 80% coverage is achieved. At high caseloads, maintenance of optimal TTIQ is unlikely to be possible. In such instances, the Doherty Institute state, flexibility to strengthen public health social measures, generally or locally, will be needed as envisaged in the National Plan, to regain epidemic control. The required intensity and duration of such measures should be informed by ongoing situational assessment of transmission and its related health impacts. The key message is to highlight the importance of a combination of timely public health responses, that is test, trace, isolate and quarantine, and ongoing social and behavioural measures, the public health social measures, to contain transmission even in highly immunised populations. So in summary, abandoning public health measures at a 70% vaccination rate of the eligible population would not be prudent, especially for jurisdictions with active cases. So this ought to settle that debate once and for all. National Cabinet also received a further briefing on health system capacity. It was then agreed that the Commonwealth Health Secretary, Dr. Brendan Murphy, would come back to National Cabinet at its next meeting with a final whole-of-health system modelled surge and living with COVID-19 capacity scenarios that would be inclusive of short, medium and long-term work in the context of the various stages of the National Plan. So there is still more work to do in relation to our health system capacity at a national level. This work will come back to National Cabinet in 2 weeks. So for those who've joined late, a quick recap: 15 new cases, 7 of them linked, only 2 in quarantine during their entire infectious period, and at least 7 infectious in the community. 8 people remain in Canberra's hospitals and 1 in intensive care, and we send our love and support to the family of that individual. I'll now invite Dr. Karen Coleman to provide an update on epidemiology and the new cases, and then we'll both be available for questions. Thank you.
Good morning, everyone, and thank you very much, Chief. So the total cases for this outbreak is now 601, with 15 new COVID-19 cases notified since our last update. We do continue to see people recovering, and our total number of recovered cases is now 364. We continue to manage 237 active cases. Of the new cases today, I can confirm, as per the Chief's comments, out of the 15, 7 can be linked to known cases or ongoing clusters, while 8 remain under early investigation. And of the 7 that are linked, we know that 6 of these are household contacts. Out of the total 15, 2 were in quarantine during their whole infectious period, and therefore no risk to the community. Of the remaining 13, 7 did spend some time in the community for at least part of their infectious period, and as before, 6 remain under early investigation. To 8 p.m. last night, we had 8 people in our hospitals. Our youngest patient is under 12 years of age, with the oldest in their 70s. 1 person is in ICU and they are being ventilated. And of the total 8, 5 are unvaccinated, 1 partially vaccinated with 1 dose and 2 fully vaccinated. We now have almost 765 self-identified close contacts and over 300 active exposure locations. But once again, please continue to keep up to date with the current exposure locations on the website, and if you have been to any of those locations, please follow the public health advice. We have no new additional active public sites of transmission to add today, and none of our new cases are linked to any of these current public sites. So today, my shout out goes to all families and carers who are heading into school holidays while we are still in lockdown. I know that this will come with some challenges and will be quite different to normal. So if you are after some new ideas to keep the kids entertained or engaged, please head over to the ACT Government Facebook page for some inspiration for the next couple of weeks. We've been doing a lot of work around how we can help with making school holidays a little bit more enjoyable during lockdown. And while I'm talking about school, I do want to give a big thank you to the Year 7 students of Radford College, who have all written poems to thank and support our healthcare workers. I'm just going to read the following poem by Amy. Oh, healthcare workers, how sad we can't see your beautiful face behind the mask. Your wonderful style cramped by the protective clothing you wear. Having you there makes everything better. I listen to your comforting voice. Life without you would be scary and dangerous. Oh, healthcare workers, how I'm grateful. So thank you to Amy and the Year 7 students of Radford College, and I'll hand over to Chief now to take first questions.
Thank you, Darren. Happy to take questions.
Chief Minister, following National Cabinet yesterday, you mentioned medium restrictions. Can you give some more detail about what medium restrictions mean? Is that premised by stay-at-home orders still, or are lockdowns considered higher than medium?
The Doherty Institute modelling in relation to medium was benchmarked against the New South Wales restrictions at the start of their outbreak in winter of this year. So the example there is stay-at-home orders except for work, study, and the accepted reasons for leaving home. So it's in shorthand, it could be described as lockdown light.
So essentially lockdown light will be in place until at least the ACT hits 80%?
No, because there are a range of other subsequent and linked public health social measures that are contained within that medium parameter that could be dialed up or down. But to be clear, it will not be Freedom Day at 70%. It never was and it never will be at 70%. It's a gradual ease out of the current restrictions.
Following the modelling, we've heard some discrepancy between the time period when we will hit 70 and 80% and the national will hit 70 and 80%. Can you shed some more light, given the updates you received at National Cabinet, what the ACT will do compared to the national benchmarks, given that there is likely to see a decent amount of time between us hitting it and the national average hitting it?
Okay, so the nation's at 70.5% first dose, and we're a little closer to 80. So we would be about 10 percentage points, which obviously depends. The difference in terms of days will depend on the vaccine take-up in New South Wales and Victoria from here until mid-October. New South Wales have a larger dosing interval, as in they're not giving their second Pfizer shot, I understand, until 6 weeks after the first, as opposed to 3 weeks after the first. That's because they wanted to get more first doses into arms. What will drive this is the vaccine supply allocations. If the ACT isn't able to secure the vaccines that we were anticipating, as I referred to in my opening remarks, then that would delay potentially us achieving particular thresholds. So my hope is that, as has been the practice from the Commonwealth, that they wouldn't be seeking to withdraw vaccines from a jurisdiction that has an active outbreak. In fact, the policy has tended to be the opposite, that they've wanted to get more vaccines into jurisdictions that have active outbreaks. So I would hope that, given we have been very generous in providing perhaps between 10 and 12% of our vaccine supply to New South Wales residents, it's varied from week to week, but I understand the average is a little over 11%. Across the duration, that we've been good neighbours for the Canberra region. We're in the middle of an outbreak, and so I would hope that we wouldn't see a reduction in our vaccine supply.
And can you just, elaborate about what we would do if we hit the target weeks ahead of the national average? Are we going to focus on our restrictions?
No, under the national plan, it is both our vaccination rate and the national average. Not that every state has to get over 70%, the national average does. And the national average, we're already there on first doses, and the national average will be driven by the three largest states, New South Wales, which has currently got the highest level of first doses in the country, Victoria, which is now the fastest growing in terms of vaccination rate because they've finally been given the extra doses that they needed, and Queensland is the third driver of vaccination, the national vaccination rate, but compared to New South Wales and Victoria, which combined are 58% of the national population, the national average is driven overwhelmingly by those two states, and they are, together with the ACT, the national leaders. So it's really about what's happening in New South Wales, Victoria and the ACT that will drive the national position. So I don't think there's going to be a major gap between the two, but to the extent that there is, that provides the ACT with even greater protection against very high case numbers as we do ease through medium to low and then to the baseline public health social measures.
Yesterday's updated modelling showed that the delay to full vaccine efficacy is taken into account when the 70% and 80% thresholds are hit.
Yep.
Given your previous comments about waiting for the full efficacy, does this give you greater confidence to be able to be moving in from Plan B to Plan C in the national plan?
I'm certainly pleased that this issue has been addressed, and I'm really encouraged by the ACT's vaccination take-up. Now, at the moment, we have about a 25 percentage point gap between our first dose and our second dose, and we're tracking around the 80% mark on first doses. So over the next 3 to 4 weeks, we ought to have got a first dose into pretty much in the arms of pretty much everyone who's going to come forward for a first dose, and that could track over 95% based on the take-up across all the demographics who've had access to vaccines to date. So that's incredibly encouraging that by the time we reach 70% double dose, we could be close to 95% first dose, and by the time we reach 80% fully vaccinated, we will have, I think, given everyone in Canberra who wants a first dose, a first dose. So I repeat the point I made in my opening remarks that a more vaccinated Canberra, a highly vaccinated Canberra, is a much safer Canberra, because what that will mean is that when the public health restrictions are eased and the virus begins to circulate at pace within the community, there will be a very small number of unvaccinated people. Now, they are all likely to get the virus, and based on what we have seen, when you get the virus, about 10% of people will require hospitalisation, and a proportion of those people will require treatment in intensive care. So the smaller the number of people who are left exposed, as in those who are unvaccinated, the lesser the burden will be on the health system and the more protected our community will be. Noting, of course, that vaccinated people can still get sick, quite sick, and can still transmit the virus and would still be required to quarantine if they tested positive. The thing that worries me is that there could be quite a lot of asymptomatic cases amongst fully vaccinated people. So they won't have any symptoms, but they will still be carrying and transmitting the virus to others. And so that remains a risk. And if they don't have symptoms, they may not come forward for testing. And so this is where the rapid antigen testing process and some more random screening in workplace settings and otherwise will be important in the next phase of what test, trace, isolate and quarantine will look like. The start of that discussion on what that TTIQ will look like as we transition through the national plan phases, the start of that conversation occurred at National Cabinet yesterday, which was great, but the work hasn't been finalised and it will need to come back. Once that's done, we'll be in a really good position to communicate to people what the TTIQ requirements are going to be. But I think if I could make one point today to vaccinated people, it's that your obligations don't end when you're fully vaccinated. You can still get the virus and transmit it, and you could still get quite sick. But being fully vaccinated appears to provide very good protection against ending up in intensive care or dying of the disease.
And the modelling also suggested, and you kind of just touched upon it then, with ramping up rapid antigen testing and those elements, but it says public health restrictions could be eased sooner if jurisdictions can maintain optimal TTIQ capability, while also noting that it's improbable at high caseloads.
Yep.
So would the ACT look to boost its TTIQ capacity in an effort to ease some restrictions sooner?
Well, the problem is case numbers. And so our set of arrangements at the moment have been keeping case numbers sort of ranging between about 8 and 32, I think, has been the range per day. When it gets above that, it starts to get really difficult to contact trace. One of the issues that we've been having day on day is that people are infectious in the community often for several days before they develop symptoms. So the optimal TTIQ is based on outcomes, not just on the number of people who might be tracing. It is about outcomes. And I think you could have an unlimited number of people tracing, but if cases don't get tested until they develop symptoms and they've been infectious in the community for a number of days, then it doesn't matter how many contact traces you have, you're still going to have a period of time when people are infectious in the community, and that's the great challenge here. And so the issue there, the factor that drives that is the number of cases. Now, some of the modelling that was presented in relation to health system capacity, for example, suggested that a high-seeded epidemic, so the situation that we are largely in now, introduced at a 70% two-dose vaccine coverage, assuming partial test, trace, isolate and quarantine, which is, I think, a fair assumption, and continuous low public health social measures in a population of 500,000, so slightly larger than the ACT, would see an epidemic that could peak at around 2,500 cases a day. Now, Canberra's a bit smaller than 500,000, but we could still, if at 70% double dose, partial TTIQ, and you had your very low level of public health measures, we'd be up for a couple of thousand cases a day. 10% of those, roughly, would end up requiring hospitalisation, and a smaller proportion would require ICU. So if we got to the situation in Canberra where we were having daily case numbers like Sydney in our population size, that would be a real problem. So we can't let that happen, and we won't.
Chief, did you get a better understanding with the new modelling coming out of National Cabinet yesterday? Do you have a better understanding of New South Wales' position around potential ease of restrictions, and potentially are they changing their attitude around how they have been speaking now previously?
I don't know that they are, but remains to be seen, because they haven't really given a lot of detail about what they'll do in a month's time, and what those. I mean, all we've sort of got in terms of public statements is that they'll have a separate set of arrangements for vaccinated people, but we don't know the detail yet, for example, of whether they'll draw a distinction in terms of activity between what you might say is higher risk, bars, restaurants, cafes. I don't know whether they're going to open nightclubs at 70% double dose for the vaccinated. I mean, we've got a pretty good case study of what happens in a nightclub when you get one case, it suddenly becomes 50. So I'll just reserve my judgment on what New South Wales is going to do until we get that next layer of detail. then, of course, you've got to draw a distinction between what they do in Sydney, or the Greater Sydney region, and then what they do for regional New South Wales, because we've seen overnight cases light up across our near neighbours. Quite a number of cases emerging now in southern New South Wales, in towns and suburbs around the ACT. So again, let's reserve our judgment on what New South Wales are going to do in the regions until we see a more detailed plan from them. But you could not walk away from yesterday's briefings, both on health system capacity and the Doherty Institute model, and think that it's prudent at 70% to be doing radical things. Small steps forward, definitely, but opening everything up at 70%, not prudent. Very clear advice provided to us yesterday.
Was the feeling at National Cabinet that the arrival of the Moderna vaccines will help get us to 70 and 80% quicker and more locally? Are you hoping that the arrival of Moderna might help make up the gap of some of this inadvertent shortfall that you've just discussed?
Well, look, the answer to the first question is yes, more vaccines more quickly is great for everyone. If there is one thing that absolutely unites every state and territory and the Commonwealth Government, regardless of whether it's a Labor or Liberal administration, is that everyone strongly supports more vaccines, more jabs in arms more quickly. Everyone wants that. And that's been a great driving, unifying force within National Cabinet to get more people vaccinated more quickly. On the local scene, Moderna starting in pharmacies, the experience when a new vaccine is brought in new locations is that it can take a little while to get the scale and the sort of pace of delivery that you want. Whereas if Pfizer in our mass vaccination clinics, we can do 30,000 a week and growing. So it will be much more efficient, and we can get more people vaccinated more quickly if we can hold that Pfizer supply as we were anticipating across October. That will help us get across those thresholds quicker and get as close to vaccinating everyone as we possibly can. It's just such an efficient delivery model for vaccination. So Moderna's got a role to play, and it's great that it's coming, and it'll be particularly good for teenagers, people under 18, because they can access either Moderna or Pfizer, and that's really going to make a difference for that age group.
Was there discussion? It hasn't been an issue so much in the ACT around vaccine hesitancy, but certainly there's significant pockets of it in Queensland. Was there discussion at the national level around what Queensland can do to try and impact on that, and whether there needs to be more done nationally to try and reduce that as well?
It was a reference in the context of those jurisdictions extending Pfizer eligibility to over 60s. So Queensland and WA and perhaps South Australia have done that, simply because the vaccination rates in those older age groups have not been as high. Sort of looking at the ACT data, when we're over 90% for 40 plus, and then if I pull out the latest Commonwealth stats, for everyone 60 years and above, we are over 95%, and that's all been, or principally been, AstraZeneca, with a small number of Pfizer with our doctor advisors for medical reasons. So it potentially sort of at the end of your program, once you've vaccinated the others, then over 60s can be, who are holding out, it would seem, for an mRNA vaccine would ultimately become eligible. But right now, I concur with the Victorian Premier that we've got those mRNA vaccines that for under 18s is the only ones that they can access. And so it's important that we focus on vaccinating those people for whom that's the only option. There is a fantastic vaccine, AstraZeneca, for over 60s, that many of the studies show actually provides longer protection than Pfizer.
Chief Minister, how many vaccines were we due to lose in October?
Look, the sort of benchmark is around 60,000, a little over half of which would have been going to GPs and the slightly less or thereabouts to the ACT government for our mass vaccination clinics. Now, the Moderna would have offset the GP allocation. What we're particularly focused on is the allocation that we're anticipating for our mass vaccination clinic. It is my very strong hope that we'll get that clarity over the weekend. And we've had the Prime Minister responded positively in National Cabinet and agreed it was a concern and something that should be followed up. And Minister Stephen Smith has been engaging with the Commonwealth Health Minister's office in a really positive and productive way. So we just want this clarified so that we can confidently go ahead with our October program. I suspect that this will able to be positively resolved. I certainly hope so. And we go into this discussion with the Commonwealth with goodwill on both sides to try and get a really good outcome for our community, noting that we've been a really good neighbour to New South Wales and our Canberra region with 11% of our vaccine supply being given to New South Wales residents in order to support a safer region.
And just back to the modelling, you mentioned we could have a couple thousand cases a day if there's low TTIQ, and base restrictions, I think you mentioned.
Low, not base, low.
Low restrictions. Given that and the fact that the national plan is to stay in line with the Commonwealth, and we're not going to have some sort of freedom day. You've mentioned that over and over again.
Well, no one's having a freedom day anywhere in Australia. The Prime Minister and every state and territory leader has been clear about that, which is, I think, a good thing. That sort of UK style, it's very Boris Johnson, and I don't know that that's appropriate in the Australian context. I think Australians have demonstrated they have place a much higher value on the health of the community, and they don't want to see thousands of lives lost unnecessarily for the sake of an announcement.
So given that, is it fair to assume we're going to have essentially stay-at-home orders or only leave for essential reasons until mid-November?
No, definitely not.
Definitely not.
No, we have lockdown arrangements in place until the 15th of October. There will be a review point in a couple of weeks. And then a further review ahead of that schedule. But no, what you should anticipate is, as I've been saying for the last month, that we'll have a gradual easing and we'll move from the high measures that we're currently in, and we've sort of been in 3 phases of high from when we started to where we are now, and we would transition through medium to low and then baseline. And that transition will occur between the 15th of October, and through into December and towards Christmas, when you'd want to be in a position that you'd have 95% of the community fully vaccinated, and you could just have the baseline measures.
The next phase of the Doherty Institute modelling also will also include work on transmission in schools and local areas. Are there particular issues in the ACT you would like to see modelled?
Yes, thank you for raising it. It was an area I had highlighted as well, and was really pleased to see that future work will occur because the previous research didn't really touch on 12 to 15-year-olds. And so, to quote from the report, given the recent shift in the national immunisation strategy regarding 12 to 15-year-old, the next work phase will include attention to immunisation coverage in school settings. And the Doherty Institute is consulting with Operation COVID Shield, which is the vaccination team effectively, to identify vaccine implementation approaches that will influence likely future coverage in schools and within their population context. So this is important work that will inform the next round of decision making in relation to schools. So it's great to see that this is happening at a national level that can provide some good, clear, evidence-based, public health-based advice to enable a safe return to face-to-face teaching in our schools. I was really encouraged to see this, and I think it will provide us with the information we need to be able to make the best decisions for our education system and for students and parents across the ACT.
And the modelling also said that there was fears that there will be an anticipated general decline in population cooperation with restrictions, even in jurisdictions with relatively low baseline transmission potential. Is this kind of speak to what you're saying about keeping those restrictions in place?
It goes to the point I made also earlier around people who are double or fully vaccinated. That doesn't mean you can check out entirely from from responsibilities around COVID-safe behaviour. So there will be some baseline measures that will need to be in place. Now, examples of that in the past have included quite high caps on major event numbers, like 70% capacity type things rather than 100% capacity. Now, one of the factors that drives that across the nation will be the level of overall vaccination coverage. So when you think about what we used to do, that you travel interstate for a sporting event, for example, the higher the level of national vaccination coverage, the safer that's going to be for everyone. So again, coming back to that single unifying point across National Cabinet and across the nation is more people getting vaccinated more quickly helps us all to get to where we want to be.
There was some reports this morning that it looks like vaccination certificates will now be included as part of Checkin applications and Service New South Wales, whatever it is. Are you confident that Checkin CBR can be adapted that way?
Yeah, so there's really, 5 different systems operating across Australia at the moment. New South Wales, Victoria, South Australia and Western Australia all have their own arrangements that are similar but somewhat different in terms of how it works in each state. And then there's a family of apps that were developed by ACT Health, the Checkin CBR one that people would be used to here, but has been reskinned and adapted for Queensland, the Northern Territory and Tasmania. Now, the back-end work to make it possible to download your vaccination certificate from the Commonwealth system into that app is underway. And so each state and territory will then allow that to occur. In the ACT context, that would be a voluntary thing. You don't have to download your vaccination status into the app. The app's primary purpose in the ACT will remain contact tracing. And as we've indicated, we don't think, given where our vaccination program is tracking, that we will need to create a two-tiered society because we will move so quickly between 70, 80 and what I hope will end up being is 95% plus double dosed, that there just will not be a need to put in place a legally complex, potentially not human rights compliant, nightmare to administer, burden on business for what could be a 3 to 4 week period only. So I think we've been pretty clear that it's highly unlikely that we'll use vaccination status as the basis in which you would access services. We do, however, and we have used vaccination status as the basis in which certain high-risk occupations are required to be vaccinated, aged care workers being an example.
We've had some reports that businesses that had previously received disaster support payments in previous weeks haven't been paid in this last week. Has the Commonwealth given the ACT government any indication of what might be around that, and is there further discussion in that?
Businesses or individuals?
It's a really good question that you ask. Okay. I've just had it put to me as disaster support payments.
Right,
sorry.
okay. So as I understand, the disaster support payments are through Services Australia for individuals. My understanding is that as long as the Commonwealth continue to deem the ACT a COVID hotspot, that those payments would continue from Services Australia. There would be no basis for us to be downgraded from a hotspot, given that we've still got active cases. We had 30 yesterday and we've got 15 today, so that would still see us triggering that Commonwealth hotspot definition and declaration. So I think that question might best be directed to the Commonwealth, but I couldn't see a reason for it, and I would hope that it's not the case, and I'm sure it can be quickly resolved with Services Australia.
It is around individuals. My apologies there.
No, that's okay.
Some detail around the Defence Force use around the ACT. Are you expecting them to be at border patrols, or is there potential for them to use?
So they're working to assist ACT policing and New South Wales policing. So they're in an assistant role, really providing some of the logistical support around the operations that New South Wales and ACT Police are conducting. This is not a blockade of the ACT, but it is a series of compliance checks, in what is a high-risk period, sort of obviously leading up to school holidays and during school holidays. People, should not be expecting heavy-handed or high visibility in terms of the defence presence. It's just some more people to assist New South Wales and ACT Police with compliance in the broader Canberra region. And I'm going to say it's fantastic that we've been able to have a joint operation with New South Wales Police. That's something we haven't really been able to do before as much as we would have liked, and this comes from some of the discussions that we've been having around the border region. And so I thank New South Wales Police for working with us.
I have some questions for the Chief Health Officer.
Absolutely.
Let me ask you one more,
okay.
Chief. Yeah. Have the government attempted to forecast what sort of impact COVID will have on the economy? You've described the business grant process as the biggest in ACT history. Have you tried to work out what sort of impact it's going to have on infrastructure projects around the territory, be it light rail, be it hospital, or dare I say it, a stadium?
I had to get the sports question in there. I did, yes. Okay, so obviously construction activity was suspended on all but a very small number of key projects for a 2 to 3 week period. So whilst efforts will be made to catch up on that over projects that have a time span of several years, some of the shorter term projects have been set back by several weeks. That has can have a mix of fiscal implications depending on the scale of the project and how much contingency there was there. The advice Major Projects Canberra have given me is that a lot of this, they believe, will be managed within the contingencies of particular projects because the shutdown period was relatively short. On the specific projects, I think we're in early works on light rail. The depot setup has now occurred in terms of some of the activity around London Circuit. Some of the early utility works have been commencing. On the hospital project, that continues. There's been work to expand ICU capacity, which I'm sure people will be pleased to hear, in addition to the surge centre. And then as it relates to infrastructure like a stadium, well, that's still very much at its early conceptual stage. And I think people would understand, in light of the current situation, that there are higher priorities at the moment. And we're outside of footy season anyway now, so I don't think there'll be any news on stadium infrastructure for a little while now. Okay, thank you very much.
Thank you.
Hello. On Tuesday, you gave a very comprehensive overview of the epidemiology of the outbreak. At that stage, there was 53 cases that were had our unknown sources. I just want to know if you have an update on that figure, not including the 8 that are under early investigation today.
I don't have it with me today, sorry. I think we're aiming to provide it to you on Monday or Tuesday next week as part of a bit more of an update, and we'll commit to doing that at least once a week, if not twice a week, moving forward. So sorry.
And I'm sure, is that the same with the reproductive rate? Do you have...
Yeah, so we'll do that as part of a package moving forward so that we can all understand where we're sitting and what the context is, because I think that's really important in terms of understanding the context and the direction of some of the other questions you've been asking about. What are restrictions going to look like? What are public health social measures going to look like moving forward?
We heard yesterday you had some concerns about compliance around construction sites and things. Do you know how many cases have been linked to construction sites, and is there more work being done around compliance there?
So I can't answer the compliance question. I do know that there is a comprehensive program in place around all aspects of compliance, and certainly construction sites and other workplaces are part of that. But anything in a bit more detail, we might have to get someone else to talk to you about that. We do have several cases in construction workers. I can't just give you the exact number at the moment. I believe we have one construction site where there's been a cluster, but the other construction workers have been related to other circumstances. You know, as members of community, they sometimes are household contacts of cases and those kinds of things. So we do have our fair share, noting how many construction workers we have in the community.
I think it was yesterday you gave a bit of an update about the disability sector and cases there, the amount of staff affected. Is there an update there? Any of today's cases part of the disability sector? And do you have an idea about how many staff are currently either in quarantine or otherwise furloughed where they can't deliver services?
So no update on the number of staff. I think it's just important to note that the impacts on a wide variety of community, including the disability sector, will continue over the course of this outbreak. And I think there's been some articles over the last couple of days about how this is impacting and how we're working with the Commonwealth Government on supporting these sectors. So just to talk through that, look, I wouldn't be surprised if there's a case today that's part of the disability sector. We're certainly seeing them every couple of days. But I don't have any specific information.
A lot of this news spread is being driven by household contacts. Are we seeing the virus spread in larger household groups like share houses, bigger families, that sort of thing?
I think it's one of the things that does make quarantine and isolation really hard for people. I know that Dr. Vanessa Johnston has talked a little bit about this with you and myself as well, but your household circumstances does make it difficult. So those families who might have multiple families in one household, shared household, and we've certainly seen examples of all of those. I think what we do is we endeavour to work with the families or the groups within those houses to look at other alternative options to support them in quarantining. But that will continue to be the case, and that's exactly what we see in Victoria and New South Wales as well. Thanks, everyone.
Another dollar.